Hello and welcome to the Living Confidently Sight Loss podcast with me, Mike.
Hi, and it's Amanda.
And this week we've got a very special guest with us. We've got Linda, who is our Eye Clinic Liaison Officer here at Envision. Good morning, Linda.
Good morning.
How are we today?
I'm well, thank you.
Jolly good. Now, for listeners who might not know, what does an Eye Clinic Liaison Officer do and why is your role so important?
Okay, as an Eye Clinic Liaison Officer, or ECLO for short, I work here at Envision and within the hospital ophthalmology department.
Okay.
I also provide a bedrock of core support for patients from the point of diagnosis and subsequently along their journey toward acceptance of sight loss. When someone receives difficult news about their vision, it can feel overwhelming for them. Some eye conditions have names you may never have heard of, such as macular degeneration or retinitis pigmentosa or homonymous hemianopia, to name a few. And my role is to provide clear information on these eye conditions, along with emotional support and practical guidance. I help people understand what their diagnosis is and what support is available and how they can continue to live independently. I find being there early in the journey helps people feel less alone and gives them a clearer path forward. Working at Blackpool Teaching Hospitals, you may see me on the Eye Clinic or Medical Retina Unit, Ophthalmic Surgical Unit or in the Orthoptic Department. Going to hospital is always an anxious time, and I recognise this. It's all about waiting well, either between appointments or waiting for treatment or getting results. I can accompany patients to their appointments and ensure before they leave the hospital that they understand what has been said and what happens next. Some patients don't receive their appointments on time or they get cancelled, and this is something I can help with. I work closely with the consultants and their secretaries, and their support for my role is invaluable. I'm in contact with them daily, and I attend the directorate monthly meetings so that I'm well informed. I'm also part of the Hospital Patient Experience Committee, who look at how best to improve the patient's journey, and I'm the voice on that panel for everyone with a visual impairment. I also offer support when a patient is taken into hospital, and this can be for a condition often unrelated to the sight loss. So I visit on wards and I talk to the staff, explaining the patient may need a little extra help. Most people manage quite well at home, but when they're taken into hospital, maybe in the middle of the night, this can be disorientating. I also speak with family members and I keep them informed, but I must stress, however, that I'm not medical. If patients have clinical questions, then I'll speak with the medical team to gain the answers for them. The ECLO service is there for everyone and it's free, so please just ring me here at Envision for support, or you can ask the hospital staff while you're there and they'll contact me on your behalf.
Thank you very much. I think you've answered the next question, but I'm going to ask it anyway. What kind of people do you typically support through your work?
Well, I've got an answer for that as well.
Yeah, go on.
Well, I support a wide range of people. That can include older adults who are losing their vision later in life, or working age adults who are adjusting to a new diagnosis, and sometimes younger people who are navigating employment with a visual impairment. Every person's experience is different, but they're often going through a period of change and uncertainty. I'm not just here for the patient, but for the family and the carers as well. And I support the consultants and all the staff within ophthalmology, and in return they embrace the role of the ECLO. It has, I must say, taken many years to achieve this awareness, and as new staff and doctors arrive, I introduce myself and inform them of the work that we do here at Envision. One thing as well, I guide patients through the process of certification. The eligibility for this is determined by a consultant when their vision falls within registrable limits. There are 2 levels, sight impaired and severely sight impaired, and a document called a CVI, that stands for Certificate of Visual Impairment, is prepared by a consultant. And for some of the patients, this can be a difficult and emotional time. And as the ECLO, I am there for support.
Yeah. What are some of the most common concerns that people have when they're first told that they're experiencing sight loss?
Many people immediately worry about their independence. They ask questions like, will I still be able to work? And can I continue driving? That's the most common one that I usually get from many patients. Also, how will I manage at home? There's also a lot of emotional impact, fear, shock, sometimes grief. People often worry about becoming dependent on others or losing the activities that they enjoy. And some patients may have experienced other major health issues in the past, and they've coped well with that. And yet, once their sight starts to deteriorate, it's a huge change, Mike.
I can imagine. Yeah, I mean, talking from personal experience, I mean, within the last few years, I've started to wear glasses, and I've started to notice my eyesight is slowly deteriorating. And having diabetes, it doesn't help because I've been having injections. Recently had laser eye surgery, and it's the fear of becoming dependent on others.
Yes.
I suppose it's not what you want for yourself, but yeah, it's just the fear of I can't do things for myself anymore, or I'm having to rely on other people. It's having that independence slowly taken away from you. Yeah. I mean, from your experience, what helps people begin to rebuild that confidence after losing some, if not all, of the sight?
I think information is important,
Yeah.
support, and time. Time is key. You know, when people learn about the practical tools and the services that are available, it can make a huge difference. Meeting other people as well who are living well with sight loss can also be very powerful. And gradually learning new skills and adaptations helps people to realise that they can still live full and independent lives.
Yeah, I mean, you just touched on it. I mean, what resources are available, especially in this area, for people adjusting to sight loss?
Well, there's many different types of support available. This can include low vision services.
Yeah.
We offer a low vision assessment here at Envision,
Yep.
and it's free to all. We provide aids here, such as magnifiers, to assist with reading, TV glasses and overglasses to help with glare, and it's all free. So if someone can't get down to us here, we also, if they're housebound, we offer a home visiting service for these assessments. So it's open to everybody who is experiencing any form of sight loss. We can also refer to rehabilitation specialists who teach daily living skills. And people can also access benefit advice, mobility training, and assistive technology support. And I must say, for our younger patients, children, we now have a dedicated person who supports the children and their parents both at home and at school.
Yeah, that's Steph Connor.
It is indeed, yes. Steph.
Yeah, we did a podcast recently with Stephen Bailey, which is available to listen to still on our Spotify. So if you haven't listened to that one yet, please do feel free. There's one about low vision assessments as well. So if you're unsure about a low vision assessment, you can always skip back a couple of episodes and have a listen to that one as well. Just having a look at the technology, Linda, how can the technology help people with visual impairment live more independently today?
Technology advancements have made a huge difference. Smartphones now include things like a built-in accessibility feature like screen readers, magnification, voice control. There's also apps that can read printed text aloud, identify objects, or help with navigation. These tools allow many people to manage everyday tasks like reading letters, shopping, or travelling much more independently. It's worthwhile contacting us here at Envision, as we can offer one-to-one advice, and we also offer support with technology in group sessions as well.
Oh, that's brilliant, yeah. And you mentioned before about the daily living skills. Is there any particular skills or adaptations that make the biggest difference for people?
The biggest... Sometimes it's not so much the biggest difference, it's sometimes the simplest changes that have the biggest impact. I often hear people say to me that, and it only happened last week, they can't get the toothpaste on their toothbrush. And we always laugh because I advise them to pop the toothpaste onto the top of a Pringle pack. I mean, other brands are available, but the Pringle pack is the one. And to dip the brush into it. Also, things like better lighting at home, using high contrast markings on appliances, organising items within the home consistently. Yeah. Not moving things about too much so they know where everything is. Learning safe mobility techniques, and that can make daily life so much easier. And rehabilitation training can help people develop practical skills for cooking, managing medication, and moving around safely. There's a small gadget called a liquid level indicator. It's only about 2 inches high. And it's really useful for people when they're pouring liquids, as sometimes it's quite difficult to gauge the depth of liquid in a cup. Those can be issued free of charge through the rehabilitation officers that come out of social services.
Oh, brilliant.
I mean, you've painted a very vivid picture there of some of the day-to-day practical things you can do to make life easier, and so you can live more confidently with sight loss and to build independence. But and that's all excellent information, thank you, Linda. But I think one of the things that's sometimes forgotten is how hard it is for family members and friends to make their adaptations. They need to be able to support somebody with sight loss without taking away their independence. Have you got any suggestions on this?
The best approach, I find, is to offer support, but not to assume what someone needs. So asking, how can I help, is really important. Communication is vital. It's also helpful to understand that the person may want to continue doing things for themselves, even if it takes a bit longer. Encouraging independence while being patient and supportive make a big difference. So it is the communication. We had a husband and wife once, and he said, you know, when I want the help, it doesn't come, but when I don't need the help, it's there in abundance. And it is about having that discussion and saying, these are the tasks that I can do and that I want to continue doing, but I could use with a little bit of help with doing this. So it is
honesty and openness, and not being afraid to tackle those issues, and not being afraid to air them out and find the best way forward. One of the things we pride ourselves on at Envision is trying to build a more inclusive society in general. We do sight loss awareness training, things like that. How important is it that people with sight loss, living with sight loss, have community support or peer networks that they can refer to?
Community support can be incredibly powerful, and meeting others who understand the experience can reduce feelings of isolation, and they can share practical tips and encouragement. Peer support groups often help people realise that they're not alone and that others are living actively and fulfilling lives with sight loss. We hold coffee mornings across the Fylde coast at our cafe clubs, and these are great for meeting with others over a cup of coffee in a relaxed setting. And for those who are able, we hold yoga and wellbeing groups here, along with a walking group in various locations locally. There are dance groups, craft groups, there's a social centre, where people can come for the day on a Thursday, enjoy a 2-course hot meal and entertainment. And if someone is feeling particularly isolated, our befriending service can call them and they can have a chat. We hold group meetings as well for those patients who have suffered sight loss as a result of a stroke, so that they can come together in a safe space and talk about their experience, how they're feeling and how they are coping with daily life.
Could you share with us a story of someone that you may have worked with who's found that new confidence after their diagnosis?
Yes, I remember supporting someone who initially felt their life had completely changed after losing a significant amount of vision. They were very low and they were worried about leaving the house and they felt they'd lost their independence. But over time, with support from us here at nVision and the rehabilitation services and learning to use assistive technology, they gradually rebuilt their confidence and they started attending local groups, using accessible apps on their phone, and eventually began travelling independent again. And seeing that transformation was incredibly rewarding.
I can imagine. So, what are the ways, beyond what you've already mentioned, which is all excellent information, what are the ways people with sight loss can stay active, social and engaged in our local communities?
There's many opportunities now. People can join local social groups, sports activities that are adapted for visual impairment, there's creative classes, or there's volunteering opportunities, which we have here as well. And staying connected with others, I think, and continuing with hobbies or discovering new interests can be really important for well-being. We have Talking nVision, which is a great way to listen to local news and information. And if someone is unable to read due to their sight loss, this is a great tool. And if you're listening to this podcast, you'll be aware of this free service.
Indeed. Yeah. Obviously, you mentioned volunteering there, and we're always looking for new volunteers. But if listeners want to support someone with sight loss in their community, are there small actions that could make a big difference?
Small things, as I've said, really matter. And I think being mindful as well. Being mindful of obstacles in shared environments is so important, and supporting inclusive community activities helps everybody feel welcome. Also, I'd say to anyone, please just give our number out there to anybody who is having difficulty with their reduced vision, or even if they're struggling to come to terms with sight loss, because we are here and we're here to help and support.
That's a very good point. Spreading the word about what we do is something everybody could do to support people with sight loss. So, what is it that gives you the most hope and inspiration in the essential work that you do?
I think it's the resilience of the people that I meet. It's a privilege, I always feel, to meet with these patients. They let me into their lives, and many people go through a very difficult adjustment period, but over time they'll find new ways to adapt, to rediscover their confidence, and to continue doing the things that matter to them. Seeing that journey for me is incredibly inspiring. And I always say that if I can help just one person every day, I know then that I've made a difference.
Wonderful. Yeah, it's fabulous to hear what an ECLO does, and it obviously is a very, very essential service. So thank you, Linda. If there's one message you'd like listeners to remember about living confidently with sight loss, what would it be?
Sight loss is not usually life-threatening, but it can be hugely life-changing. But it doesn't mean that life stops. And therefore, with the right support, skills and tools, people can continue to live independent, active and fulfilling lives. And lastly, please remember, I'm always here to support you on your journey through the hospital setting.
Excellent. Summed it up nicely there. So, Linda is part of our team at Envision, as well as being based at the hospital. So could you kindly remind us, Mike, how to contact Envision should you wish to engage with Linda or get involved in any of the wonderful services that she so kindly outlined for us?
Yes, certainly. So best way is to ring. If you give us a call on 01253 362696. That's 01253 362696. Or you can drop us an email if you like. Our email address is info@envision-nw.co.uk. That's info spelt INFO at, which is the little A with a circle around it. Envision is spelt NVISION -nw.co.uk. Linda, thank you very much for coming in.
You're welcome.
I hope you've enjoyed it as much as we have. It's been great to have you on. I know you're a very busy lady, so thank you very much for finding and taking the time to come and talk to us.
Yeah, thank you, Linda. And just to remind people that these podcasts are a series and all fit together rather well, I must say. That's our teamwork there, Mike.
Yeah. But they're all available on Spotify and on YouTube. So yeah, if you want to go back and listen to any previous podcasts, as I said, there's the one with Stephen Bailey on the low vision assessments. There's that one. There's lots of others as well. So please do feel free to go back on previous episodes and give them a listen to as well. So until next time, thank you very much for listening. Take care, and we will speak to you soon.
Bye, everybody.
Bye-bye.